Thank you, Cha. Good morning, good afternoon, good evening. This is my pleasure to introduce the two speakers that we have from the World Bank team here. Um, the first speaker will be Matthew Hulse. Matt is a senior health specialist and a focal point for digital health at the World Bank's Health, Nutrition, and Population Global Unit. And he is an electrical, computer, and software systems engineer with diverse experience in embedded devices and digital communication technologies. And he has worked worldwide on telecommunication access issues, expanding digital and economic development, and then also on humanitarian assistance. Matt advocates viewing digital health as infrastructure critical towards effective healthcare delivery. At the World Bank, he advises technology investments in health service delivery, as well as serving as the coordinator and representative for various health data, digital information working groups. And the second speaker we have here is Ali Habib. Ali is a senior digital health specialist at the World Bank's Health, Nutrition, Population Global Unit, and he supports the development of knowledge products aimed at supporting clients with digital health implementation and advises on the planning, design, and implementation of World Bank finance digital health initiatives. Prior to joining the World Bank, Ali led software company that implemented open source digital health solutions in more than 15 countries, supporting initiatives around tuberculosis, immunization, and mental health. He has over 15 years of experience with digital health. And then now, before I hand over to the first speaker, Matt, I would also like to give a quick introduction to how this topic evolved. I think it was in 2023 that we started working, our World Bank team started engaging with us, and then this topic was very interesting. Give you a bit of a context that AeHIN broadly, in its mission to support the digital in health programs of countries, there are broadly, I would say, that two scenarios. If the country has a digital health, national digital health strategy or a blueprint already in place, or it does not have. When it has, and it has problems of operationalizing it, then AeHIN actually works together with the countries and partners and then convenes the convergence workshops, bringing together the resources to make the strategy operational. Or when the country does not have a blueprint, how AeHIN uses this methodology to bring together the various stakeholders within the country and external, including the partners like World Bank, and then uh, works on evolving a strategy that the country could actually resources and implement it. So in that context, like we had this webinar on the digital health blueprint toolkit when it was still in the development phase. And then during the AeHIN general meeting held in Jakarta in 2023 in November, if you remember, I will also share the link. The topic itself was putting the blueprints to practice because we wanted the countries to actually take the blueprints into action. So today, of course, it has been 3 months since the blueprint has been launched officially at the Nairobi during the Global Digital Health Summit. Now we will have the blueprint being shared, and this is also AeHIN's vision that the countries could actually absorb this and then become self-reliant to actually support the national digital health ecosystem. I would like to hand over the floor to Matt, our first speaker.
Thank you so much, John, colleagues from AeHIN, and thanks so much for hosting and inviting the World Bank, Ali, myself, to present on this topic. I'll shortly share my slides, but wanted to acknowledge that wonderful introduction and the context of this work. And I'll also add my own contextual introduction, which is that this is a very long life cycle topic in the scope of digital health, and with an acknowledgement of many of the individual contributors, other partners, governments, great civil servants and champions in digital health that have also contributed to this, informed a lot of work. To your point, Jai, it builds upon a lot of the themes that were early introduced to the world around the convergence methodologies, around bringing stakeholders together. Colleagues from the Asian Development Bank that proposed a lot of economic evaluation frameworks around digital health played a role into some of the investment modeling that's come out on this. And we know that our own colleagues that work in our WHO global offices and other regional groups are proposing architectures that we also see can be integrated or applied over time in sort of an evolving set of resources that not only has been addressed before, like you've mentioned around putting blueprints into practice and similar, but as a set of tools and resources that can go out and be continually used as countries continue on the journey for digital health transformation, evolving architectures and deployments over time. So with that, I wanted to provide a few introductory remarks around specifically the comparative advantage of the role that the World Bank had seen in contributing to this space, as well as respecting a lot of the acknowledgement of what's been done so far and how we frame the work around sort of digital health blueprints and similar in the context of health systems reform and transformation. So with that, I will begin, and thanks so much. We encourage your questions in chat, and Ali and I will go back and forth on trying to answer them when each other person is not presenting. This, to many of our colleagues online, I think, have a lot of similar alignment and vision around the state of digital health ecosystems and public health service delivery around the world, both the opportunities and challenges that they face. We're in the last year of the World Health Organization's global strategy on digital health, which talked a lot about the ecosystem factors that mean it's not just the technologies and the architectures, but also the fiscal planning, organizational capacity, the leadership and strategic work, which in sort of the life cycle of applying technology for health system transformation is well respected and integrated in kind of the process that we're talking about today. We know this strategy is likely to also be extended and is still part of the journey that many health systems and public health agencies around the world are journeying through. Even with that optimistic vision of how technology can really support stronger health system reform, the effective delivery of services, the availability, access, and an impact and quality that can bring towards health service delivery, we know that within the technology layers and some of the capacity of folks that are integrating them, we face many day-to-day challenges which keep us up late at night and keep us hard at work trying to work on things. That includes a proliferation of issues we know have been experienced by many folks online and a lot of the members of AeHIN and beyond around slowly working towards the adoption of standards-based tools or standards-based architectures across very complex health delivery networks and units. The proliferation of lots of tools, partners, firms, third-party networks and similar, which may or may not participate in good faith around governable or interoperability pieces, have some challenges around long-term sustainability planning, or even questions on quality and impact, while in the best intentions, hoping to over time leverage that technology to get better outcomes. We also know that because of just the nature of health service delivery design, sometimes a lot of care pathway models are disconnected. And we apply technology in ways that doesn't leverage sort of the network effect or the network power of that, where we might have fragmentation in our digital tools or similar. That also bleeds into how we invest in digital health and, of course, the way we can engage our health workforce on the supply side, or even patients and households on the home level around how they can participate and use technology to engage better with their health and their care networks. So this kind of landscape, which seems to be a steady state that we collectively are working towards addressing and delivering on better health, are all factors that through both prior work and sort of the formalized work of the release of this digital health blueprint toolkit as of December last year, has really taken into effect around how do we work through some of those challenges and do things in a whole of health systems approach. The next piece I just wanted to share is one of a few of the reasons around why the World Bank is a health financing partner and specifically tried to bring some support to this space, and again, being welcomed that we could participate in this own convening. We're often functioning at a level to support public health agencies and public health care networks to undergo the types of reforms to provide better access, to reach those targets, particularly the most vulnerable households or the poorest individuals in societies, to also participate equitably in access to quality care. Our own sort of mission goals around this includes aligning with the Sustainable Development Goal 2030 targets of improved access to universal health coverage. And we're partnering with lots of client governments around the world in financing health systems to try to achieve increased access to over 1.5 billion people by 2030, as sort of a milestone target around what we can do as a health financing partner to do that. And as previously shared, and thanks for their warm remarks on an introduction, certainly believe that technology is one way to both accelerate that access, ensure that quality and compliance might be delivered, improve maybe the efficiencies or reach at a kind of whole of health system level, particularly if we take the enterprise approaches that are being talked about today. We see that those health reforms and technology itself, it's really a platform to tackle a lot of the things that we're trying to see in how health systems are evolving over time. Increased efficacy in financing efficiency, the standardization of our services, and in all of the important sort of burden of disease channels and vectors, whether it's communicable disease, the burden of non-communicable diseases that's growing and challenges, the cross-border challenges around health emergency response and preparedness, even the ongoing challenges of addressing the climate change and what's happening and sort of how health systems are responding, adapting, and their own role in mitigating that. Technology is an underlying pillar, the data that it delivers to address a lot of these challenges. And so that's one reason where when the bank is approached as a financing partner to a lot of public healthcare systems and technology as a reform area, we want to put forward a lot of the approaches that we've learned both in this community as well as this story around what's happening with digital health, the concepts of blueprints and architecture, standardized workforce and capacity as a holistic or a way to address a lot of these challenges. And then the second framing I just wanted to present before I pass it over to my colleague Ali is that outside of health, we know that many communities and societies around the world are continuing on their journey of digital transformation. And even just this week at the World Bank, where we're hosting an Accelerating Digitalization Summit, where how digital technologies can be used to address many sectors and challenging the gap of fulfilling, providing better access to jobs, providing better access across many services. We know that several public agencies and governments around the world are pursuing a digital transformation journey and kind of the next generation of digital government services and data and digitally enabled pathways for access to citizens. And healthcare is, of course, no exception, if not one of the biggest pillars around a role for public service delivery. Because of that, we already know a lot of storied history around what has been developed within the healthcare sector around kind of architecture approaches. You'll see a lot of references towards frameworks like the Open Health Information Exchange approach that is in itself kind of its own version of creating a public infrastructure layer for healthcare that, along with what we've all collectively built knowledge around enterprise architecture frameworks and technology modeling, really believe that some of these concepts around a common health record or a unique health ID, standardized service lists and similar, really align with what we're seeing even outside of health with digital transformation efforts and kind of to build work with a lot of that alignment. So with this, I just wanted to share and summarize before we dive into the toolkit, that framing of where we have seen and observed health systems are going and the challenges that they face, what technology can do, how the World Bank tries to be a strong partner at that holistic level around doing that, and approaches like the Digital Health Blueprint Toolkit can help our clients achieve in that goal. And even as we continue on journeys in digital transformation beyond the healthcare sector, how the examples we're doing within health can contribute a lot towards that journey and align with what we're seeing happening around the world. So thanks, and I'd like to pass to my colleague Ali to talk more specifically about the architecture modeling in the toolkit.
Great. Thanks, Matt. And while I pull up the slides, thank you also to Jay for pasting such incredible relevant links in the chat as we've been going. Really helps to contextualize the work. Thank you, Matt, for that a great framing of the kind of the thought process behind where this work came from. And I'll now kind of get into the specifics of it. So first of all, the word blueprint has been used in many different contexts. Some people define strategic documents as blueprints. And so first of all, just to sort of get a level set on the terminology here, the reason for this work was that we've observed that a lot of countries have developed national digital health strategies or e-health strategies, and these are principally vision documents. There are different levels of detail depending on the country and who developed it, and you see a range of this, but they're principally vision documents. And even the most detailed strategy documents often do not go into the level of implementation detail that you require to then figure out what this would cost and how you would implement this at national scale. And as a consequence of that, a number of these strategies that look really good, in principle, actually don't get implemented, and they end up sitting on a shelf, either a physical one or a virtual one or both. And that's clearly a problem with scaling up, these kind of visions. And so the blueprint in the context that we are using the term is much more of a detailed guide into how you would scale up digital health in the country. It gets into nuts and bolts of the design and the implementation, the management of these systems. It sort of aligns with the health priorities, and that's critical because if it's digital health, it's not digital for the sake of digital. And so it's critical to ground these approaches in the country's health context. And then, prioritizing the best practices, interoperability, scalability, sustainability, so that the thing that gets implemented actually aligns with the vision. And that's sort of where we are using the word blueprint. And our friend Derek, who's on the call, who helped us actually work on this, and so shout out to Derek Ritz, has a very good analogy on this that we've kind of been reusing. So I'll take that opportunity here. Is that when you are building like a skyscraper, and you have an architect develop a 3D vision for you, and so you get this very nice 3D model. There are birds flying in the sky, there's grass growing around, there are cars driving by, but all you can see is the outside of the building. You can't see what makes it tick, what's going on inside. And the blueprint is actually the equivalent of those electrical plans, the plumbing plans, the internet access, emergency exits. All the stuff that it takes to actually create this is in that more detailed planning that is developed by specialists who actually bring that creation to life. And so that is the rationale of the blueprint here in the context that we are using it. And so it talks about the how, and there's a great quote here from Jay at AeHIN. So thank you for contributing that, to indicate, of course, that AeHIN's vision of these blueprints very much aligns with ours. And so we've been telling countries or advising them what to do for a really long time. All of us have, but the how is where the rubber hits the road, and where you really need to sort of in the country context help implement these strategies. And there's a number of pieces in the blueprint, specifically, that I'd like to highlight. One is that we've all seen situations where you've got healthcare workers entering data into an HMIS at the end of the month or the quarter or the whatever time period, and it's a significant effort that takes away from their healthcare provision tasks. These are not data entry specialists; these are often nurses or doctors who see patients in the day and then do data entry at night. And one of the real advantages of creating the exchanges, the health information exchanges of the sort that the toolkit talks about, is that task then gets automated. And so you've got healthcare providers doing what they do best, which is treat people and help people out in the health context, versus sitting and doing data entry in the evening. And it also makes use of computable care guidelines. Example of those, of course, is the WHO SMART guidelines to introduce a quality aspect into the work. And it basically establishes a roadmap to get to a future state, using DPI to get to a future state for digital health in the country, as envisioned in a strategy document. And so what the toolkit is. So we've talked about what the blueprint is. We talked about why that's useful. And now, what is the toolkit? And you can download the toolkit from the QR code here. It's basically it's a set of resources that you can customize to country context to help governments to either create or re-engineer their care delivery network, depending on the context in the country. Every country is in a different place on their journey. And so you can basically start where the country is and adapt it from there. And you'll see that the word buildable blueprints here, which is important for us because these are meant to be implementable documents. These are not meant to be something that's developed and put on a website and forgotten about. And I think the other piece that's important is that it's not just a roadmap, it's actually a costing as well. So the costing of the setup and then the maintenance, which is critical, of these architectures and exchanges over a period of 10 years. And it helps you model what the return on that investment might be. So I'll talk about that a little bit later, but the idea is to sort of give countries a way to model when they might see a return on this investment and how they might see that return. So what's in the toolkit? A number of different things, and you can, Jay kindly pasted the link in the chat. You're welcome to download this. It's open for everyone to use. But it's a number of different things. So one is, of course, a how-to guide. So how do you use the toolkit? This is guided to a facilitator who is supporting a country through this process. It's got a number of other facilitation aids, presentation templates, document templates, reference material. There's also a skeleton blueprint document. So as you go through the process, you can kind of build your blueprint as you go. So at the end of the process, you pretty much have a ready document. There are costing tools. There are also samples of what a blueprint and a costing would look like to guide the process. And also includes, for example, typical governance structures, etc., as a guiding resource, if you can see, on the slide here. And so what do you get out of it? You get two things. One is a design specification, a very detailed design specification, which is contextualized for the country. So for the country's health context, the country's digital context, the country's strategic context, the political context in many cases. So all of that is taken into account, in this process. And then you get a 10-year investment rationale, which is based on that specification. So what would it take for this country to implement that specification? And the costing is based on that, and then the investment is further based on that costing. And important that this is not something that we developed because Matt and I, sitting here in Washington, thought it was a good idea. This was based. I mean, we did, but that's not why. That's not the only reason why we developed it. This actually, we saw this in the countries that we support, and in a number of countries that we were supporting through the World Bank, we saw this gap where strategies were not being implemented, and they were just, sitting around basically the strategies. And so this was developed in response to that need in a way that, and the process is it's a single, toolkit. We don't make a new toolkit for each country, but the toolkit can be used to contextualize the process for each country to get an output that is relevant to that country. And we've, engaged with a number of different stakeholders, as Jay mentioned, very early on engagement with AeHIN on this. And we've used an iterative approach. So before we actually released this in December, we'd gone through several different iterations. And in December, after we had actually used the toolkit in Kosovo, along with their Ministry of Health, and then kind of learned from that experience and further adapted it, that's when we felt comfortable kind of now putting it out into the world, having used it ourselves and adapted from those learnings. And the idea is that any country should be able to use this regardless of where it is in that digital health journey and without heavy technical assistance. That's also very important. A couple of other benefits that you get from using the process, going through the process in the toolkit. One is that there's a lot of capacity building that happens both during that process, as well as you get outputs that support capacity building in the country, which is including costs, as an example. You also get alignment. So a key part of the process is to look at the existing strategic landscape, both for health and for digital health, and to identify any misalignment so that can be course corrected or at least called out and recognized as you go forward. And then also a view of the national policy landscape. For example, data privacy laws, data confidentiality, data sharing. If you create a health information exchange in the country, but you don't have a legal framework or a policy framework to support that, then that technology can't really be used effectively. And so that has to go hand in hand and is of course a big part of the typical enabling environment structure that we're all familiar with, which is the legislation and policy landscape and strategic landscape. So all of that is aligned as part of the process. Now, what is the process? So essentially, the process is that a facilitator, typically somebody who is country based, but not necessarily, takes a country-led working group. So it's just typically Ministry of Health led over 5 workshops. Each workshop is a day long, and each workshop builds on the previous one. And I'll talk about the workshops in just a second. But these are interactive workshops where you want a multi-stakeholder working group. So you want people who are able to sort of talk about the country's context in some level of confidence and to make some draft decisions as well. And so what should the working group typically look like? Generally led by Ministry of Health. In many countries, you may want to have other development partners and funders as part of the conversation, active NGOs who are helping, in a big way in the country, care providers, very important to get the context of healthcare providers, and then any other partner ministries. So in many countries, this can be the Ministry of Finance has been involved. The Ministry of IT is a very commonly part of it. In some cases, the Interior Ministry when it comes to things like identification. So depending on the country context, but the idea is that these are people who should be able to speak authoritatively on their field because you want that contribution. And the rationale for this kind of multi-stakeholder group is that you get all the voices in the process. And when we did this in Kosovo, which was the first time we did this, the General Secretary of Health, who championed the process there, I remember this vividly, told the stakeholders that, look, this is the opportunity you have to make your voice heard. And if you don't speak up, then forever hold your peace. So he took sort of that approach to it and said, look, this is the time to speak up. And then if you're left out because you didn't engage. So that is the kind of idea behind the ownership in the process. The facilitator should ideally be someone within the working group because then they can stay engaged with the process beyond the implementation process. But understandably, this is often not possible in many country settings, in which case you can bring in somebody outside. But we would advise that if you bring somebody from outside, pair them up with a local person. Because if you just paradrop someone, into a context, they don't have the ground realities. The local kind of counterpart can help provide that. So the workshops. The first workshop is a grounding exercise. What are the use cases for health in the country? What's the disease burden? What's the digital context in the country? What's the readiness looking like? And you can use resources like the Global Digital Health Monitor, among others, to kind of get to a consensus on where the country is. So this is where the first workshop is where you level set and you get everybody on the same page. This is also where you look at the current strategy and strategy landscape and you identify any misalignments or highlight any alignments that you have. The second workshop is very technical. It goes into the nuts and bolts of fire. It gets into fire profiles, what it would take to. This is where you actually create that specification. And in this process, we also look at the smart guidelines where relevant to see how those can fit in. At the end of a second workshop, what you have is a draft norms and standards for the country in terms of data sharing and data exchange and the standards that you want to use. The third workshop looks then in detail at the current landscape and says that, okay, now we've got these draft standards. Let's look at our current landscape and see which of the existing investments we have, because every country's typically got something on the ground already. So which of these fits into our can be brought into conformance and which ones can't, and which ones, if there are some that are non-conformant, can we make them conformant? Do we have to sunset them? How do we leverage the data in these systems for our HIE? That this is where that happens. The fourth workshop then gets into real details on the implementation plan, including legal, privacy, security, the governance structures, which are so important to maintain these things going forward. And then the fifth workshop takes into account all of the above and gets into costing and investment. This is a visual illustration of the process. And so you can see that during each workshop, before that, there's pre-read materials for the technical working group. There's background research and preparation that the facilitator does to make sure that they are able to lead the workshop properly. And there are guides in the toolkit for this in terms of how to prepare for each workshop, and what prep you need to do, what to share with participants ahead of time. There's a presentation template that you tailor before the workshop, the country context. And then during each workshop, we have real-time questionnaires that you can use to get feedback from the technical working group in real time, and incorporate that as you go. And the output of that, which you can see on the right side, is this blueprint, which includes a costing and an investment model. How are we doing for time?
We have another 20 minutes.
Okay, so then maybe I'll speak for a few minutes about the investment rationale to then get into Q&A. And if anybody has questions about the investment piece, we can address them in the Q&A. Otherwise, we won't have time left for questions. So I'll talk about this investment rationale piece quickly. Obviously, in order to implement these things, these exchanges, these architectures, and to maintain them, you have to have a costing. And countries have a hard time figuring out how to do that, in terms of how do you even start costing this out. So the toolkit provides two different things to address this. One is a costing framework, which is it's a spreadsheet that helps you kind of break down the cost elements into smaller pieces. So it's easier to sort of figure out what those costs are. And then the second piece is the value you get from doing this, which is that if you implement this well, if you introduce quality into your health system through digital tools, you will see a reduced disease burden. That reduced disease burden means you now have a healthier population, which is contributing to your economy, and so you start to see a gain through improved GDP. That's the principle here. And important to highlight that in this toolkit, we are talking about digital transformation. We're not talking about the cost or the gain from a single vertical application. We're talking about this system-wide. That's important. Some of the key cost centers that we look at, you can see them on the slide. We'll share these slides with you as well. You're welcome to take a look at the detail. But importantly, governance, data center costs, the different foundational registries, the cost of a shared health record, terminology services, HMIS, and critically, a capacity building. And for the analysis, the inputs typically include things like population, the growth, inflation, how you see the population growing or declining, how many healthcare facilities you have in the country of the different types of them, how you see those growing over time, because we're talking about 10 years. And for this is why you might want, for example, partner ministries in the room, when you have these conversations, because the Ministry of Health might not have all of this information offhand. And in Kosovo, we saw that at different points in the process, different people had inputs, including interior and finance, etc. I'll skip this slide and we go to this one. So when you finally fill out all the costs in the sheet, you get this 10-year costing, and what you see on the screen here is a fictitious one, which is showing that you need $127 million over 10 years to sort of maintain this over time. And what you see in the grid below is where this starts to pay back. So where you see the green columns in the lower table is where now every dollar you are spending on digital health is giving you a return. So you've moved from being a cost center to now you're actually supporting the growth. And this is important because digital health is so often, kind of framed as being a cost center. We always talk about the costs. And this is a way to model what the actual economic gain from doing this might be. And it can be a very useful tool to sort of prioritize this in conversations with ministries, et cetera, where they have multiple priorities to kind of help them, address that. This is a visual representation of the same thing. I'll very quickly talk about it. So this is a country where on the left side, you see a country that starts a little bit quicker and they have a few ups and downs. And then they cross this sort of red line where they become cost effective. And they get to a point where every dollar they are spending is returning $3 to them. This is one, again, fictitious analysis. The other one is one that did nothing for 3 years. They were just building. There was no scale. They were building for 3 years, and then they shoot, and they get actually to a higher scale over time. And so, depending on your implementation plan, your context, and how you plan your implementation out, you are able to sort of visualize this in different ways. And I'll leave this up. We can go to Q&A. Thanks very much, everybody.
Thank you, Ali. Thank you, Matt, for the setting the overall context. And then I think that was very comprehensively how you connected the evolving technology and how it relates to the health sector. And then Ali, like I really like the way that how you actually define what is the blueprint, because like each one could actually be looking at blueprint in their own ways. So and then also walking us through the modules or like workshops, I would say. And then also, like I think somebody also made this point in the chat, like the word implementable, right? That could also vary. It depends on the country situation. The implementable could actually have its own variance among the countries. Maybe to start some discussions, I think with any toolkit, and then also relating to the need to actually put to use this very helpful tool. I think one of the things is to build the capacity or build this community, I would say, of facilitators who will absorb and then support their own organizations or the countries. I think that is one of the things that, from the point of view of AeHIN as the regional network, we are looking at. And then I would like to have the thoughts on that front, like what will be the effort or the plans from the World Bank. And then also, what is the future roadmap like? Like we have the blueprint toolkit now, but going further, is there any other plan as progression from the blueprint toolkit that is already available for the countries? And then the third one is like the very familiar question that everybody asks. Okay, the blueprint is there. The countries who would like to actually use it, if they need support, whom do they approach? And then is there a channel for that? And then if they need, do they have to go through the World Bank offices in the country, or is there a very dedicated or a specific contact that is available for them to actually start absorbing or putting the blueprints to practice? Over to you, Matt and Ali.
So I can start with the last question, which is how can countries utilize this tool, and what will the channel be? And do you need the World Bank for it? And if you do need the World Bank, then what's the channel to kind of take that forward? So I think first of all, this is very much a global public good. It is not proprietary to the World Bank in any way, so you don't need to ask us for permission to use it. That's right at the outside. This is available online, and what we would ask is that if you do use it, let us know how it's going, so we get feedback, and we're able to kind of improve a future version of it based on that feedback. It's already being used in a couple of countries through resources that are not World Bank resources. So that's already happening. And we're grateful that people have the confidence in this to actually start using it without us being involved. That's fantastic. If you do need World Bank support, to sort of, if you need funding support, technical support, your first point of contact is the World Bank office in your country. World Bank support very much flows through our country teams and country offices at headquarters. We support them in what way they need us for, but it's very much the country offices who work with the governments on what gets supported both financially and technically. You're welcome to CC us on those communications. You're welcome to reach out to Matt or myself to ask who in the country would be a point person. We're happy to point you to them, where you think you need that help. But the kind of typical flow of World Bank support is through the country offices. Um, and Matt, jump in at any point. I will take the next one in terms of the evolution of the toolkit, and then I'll go back to the community part after that. Um, so the evolution, how we see this going, is that we do envision an update maybe a year, 18 months, 2 years down the road, depending on technology changes, depending on changes in principles. One of the developments that's currently ongoing, and those of you who were there at the Open Digital Health Summit last year in Nairobi will have seen this firsthand. This notion of a reference architecture that WHO and ITU are working on. And so when that is made, available and right, it's finalized. One update to the toolkit would be to sort of use that reference architecture. Currently, it uses OpenHIE as a framework to go ahead with. That's not hard and fast. There are other methodologies you could use as well, and we've used OpenHIE to kind of as an example in that process. But if there is a reference architecture from normative bodies like WHO. We would, obviously update our guidance to include that. Other, changes could happen. I mean, the technology evolves very quickly, so we'll keep track of what's happening in the space and feedback we get about these resources from people who use them. Our experience in Kosovo was a huge learning experience, and you would see a very different toolkit today if we hadn't done that. So every experience, adds to the value to that process, and so we're keeping track of the feedback we get, um, and so that's kind of how we see it going forward. I think in terms of the community and creating the resources for countries to do this themselves, I actually had a slide that I forgot to put up, so I'll actually share that in just a second while I'm speaking. Our intent is to scale up the capacity of potential facilitators for this work, and I'll just explain that in a second. So one of the things that we're planning to do is a series of facilitator trainings, or what we're calling boot camps. And the idea of this exercise is what we're envisioning is a 3-day training session where we invite skilled facilitators. So these are people who understand digital health. They could, for example, be people with TOGAF certifications. And the idea of this is to familiarize the trainees with the content in the toolkit, how to facilitate these workshops, and also to build up their skills in adapting the content, for the country context. We're envisioning doing these regionally, and we'll keep the community informed, as those plans solidify. But our intent is very much to help create the resources that countries can then go to, and so you don't have to come to 5 people in the world who know how to do this, as an extreme example. So that's very much the how we see this evolving and how we see a community building around the use of this resource. And critically, we also want to sort of equip these trainees to then train other experts. So you don't have to come to a World Bank bootcamp training, later on. There's only so many of these we can do, but we want to equip the participants to be able to train other people as well, and so create that community in that way. I'll stop there. Matt, welcome to jump in if I missed anything.
Thanks so much, Ali. And I'm also grateful for some of the questions we've got formally through the Q&A in the chat, and trying to answer some of those. So thanks for your patience as we go through it. I think the only other points I wanted to emphasize over what my colleague Ali shared is to talk about how, while we've called it this blueprint toolkit, but it really is about a facilitation approach, and a set of supporting resources to get there. So not unlike what a lot of our AeHIN colleagues have led on the cutting edge around convergence as a methodology or also a process. It's not necessarily like a master planning architecture. And so, as Ali mentioned, if our WHO ITU colleagues are coming out with, forthcoming evolving standards around what might be new sets of architectures, or in this blueprint process, we leverage the open HIE model as one way to achieve that journey. But the process of going through this toolkit guide is acknowledging that there might be a pre-existing national architecture that could be adopted to or fit to. It emphasizes a lot of these core components that we see to do comprehensive digital health at a whole of health system level, right? Like a common health ID or common records or standardized ways to represent care pathways and computable care guidelines. But that in itself, may or may not necessarily require compliance with one or more standardized architectures. It's the real spirit is in the process to say, using those principles of what you need to ensure comprehensive care delivery, what is the architecture that comes out of it? And that can, that may fall along the lines of what we're seeing, leveraging what other countries have done, what global standards might be, what open standards might be. But it in itself is not a piece of, this is the World Bank architecture model, right? Or the architecture model presupposed by the toolkit. And so I just wanted to emphasize that point, that a lot of the resources are available really are facilitation tools, modeling tools, framing or contextualization or approaches, references to some of the products that might be out there or models that might be out there that may be adapted through the process of the consultative working groups, mapping some of the legacy systems. I saw that came up, right? That may or may not already have applied some specific national criterias that are relevant. And so that was the only other piece I really wanted to emphasize in summary, is that it is a process to achieve that vision in like a health enterprise approach, and a set of facilitation guides and resources. So so some of these questions around, let's receive some certifications or receive some trainings or build the capacity to deliver that, in the best spirit of it is to help guide, um, you know, our public health agencies or our various care groups, around adapting and converging around some approach. And maybe the last small piece I'll say on that, I saw there was a question in chat, so I'll answer it live, is that, well, this was really focused on some of the technical building blocks and the architectures of how those systems fit into it. And we also address through the toolkit some of the costs needed on the enabling environment pieces, like the compliance bodies, the governance working groups, maybe the strategic audits or the strategic planning work, the budgeting work that needs to happen. There's a lot of other facilitated processes that the public sector can lead, and they kind of fit maybe they fit earlier or later in where a blueprint process is on sort of the transformation journey, right? So the very first stage, as was mentioned, is the leveraging an existing technical working group or building, converting a new one. And we know that there's lots of great resources out there about how do you build sort of that collective ownership of digital health transformation group, within the public health sector. And then afterwards, once you start to involve the industrial advisory councils or so there are processes that happen both before and after that are equally important for solving some of those ecosystem challenges too. And that can also be fit or, facilitated further through some of these pieces as well. Thanks.
Thank you, Matt. That was very, very helpful. Is there any other who would like to have their questions? I know Matt answered several of them in the Q&A as well as the chat. And then I did see Derek and then Ali also respond to them. But are there any other questions that we have open, unanswered, or anyone would like to ask?
Hello. Hi, Joy. Hi, this is Aminul from Bangladesh. So I got the two answer, but I did not get one answer from my question. That's why I'm asking. Since Bangladesh is basically now designing the digital health architecture blueprint, and here we are basically struggling with some issues like we don't have any data, health data governance, and we don't have any, health data standard, any policy or anything. So now, what would be the challenges, to implement the building blocks of the architecture blueprint? Because as per my understanding, these are the prerequisite, if we, develop a national, architecture blueprint. So how we can address these challenges?
It probably needs a bit of a study, if I might jump in, because the country context needs to be known, the landscape needs to be understood to be able to answer this question. But in general, if you look at the workshops which Ali walked through, probably the first workshop, if it could be kind of done, maybe you will have the answers, Aminul. Probably, I think you may have to go through the workshop, at least the first one, from what I understand correctly. And then probably this particular question may not be able to answer very easily because the country context needs to be understood. So maybe I would, I will leave it, of course, to Matt and Ali to also answer, but I'm just jumping in by saying maybe the first workshop may be helpful to go through and then probably map.
Yeah, thanks, Jai. And having some familiarity with the ecosystem there, and congratulations on so far what's already we know has been happening with the call for action in Bangladesh for a digital health agency and a digital health blueprint and building a lot of that capacity and so many of the amazing initiatives that we know are continuing on the journey towards like having a shared health record and common systems and platforms. So it is quite relevant. I'll offer maybe two spokes off of what I know, Jai, you already shared, and thanks for those thoughts. One is it's okay to iterate even on one workshop, right? If that first workshop is let's form that technical working group and convene stakeholders and understand what our priority areas are, and that might be realizing at the end of that first convening, like, oh, we actually didn't involve our private healthcare sector and delivery partners. So let's go back and see if we're really mapping like the types of care that they're delivering and it's incorporated, right? Or maybe it's like, what wasn't there around the time was the Access to Information Initiative, or the larger digital transformation and e-government, and the Ministry of ICT, wasn't available, but we realized that there's a common identity that's used. And so let's go back again and like make sure we're just getting that right set of actors, before we kind of proceed in later phases of the journey. Now, I'll offer one other counter to the point I just said, which is you don't want to spin wheels for too long. And at some point, we need to get the group and like move and to continue on the journey. But it's not to say that like we got to lock it in on the first piece and move to the next piece. You can always like bring more stakeholders. And it's a live process, not unlike, I think, the spirit of the convergence modalities and similar. And it's going to be, we're seeing digital health grow in complexity logarithmically year on year with new types of data standard requirements and AI and equity angles. So it is going to be sometimes, 3 steps forward and 2 steps back, or even 1 step back and 4 steps forward as we unlock sort of the champions, the advocates, the owners of who's going to own which parts of the system. But, through the facilitation process, we've tried to organize a way to like leverage processes like convergence to build those groups and actors that come together. The concept of do we need very specifically to your question, data privacy regulation, or how do we incorporate that, right? That could easily become a subtopic and apply its own group of like, let's figure out what those standards mean as they like are cascaded across all of the different pieces of care sharing and similar, and can easily be integrated in that process. And we're seeing more need for that now, and it might be great future additions to more specifically talk about how to facilitate those working that. Long story short, though, if there is some specific help, of course, we'd like to pitch that the World Bank can be a strong financing partner or technical assistance partner to help deliver that, and can reach out to our country teams, as Ali was talking about, to help with it. I hope that's helpful and brings some confidence to so many of those folks that are going through that journey in their health systems.
Thanks a lot, Matt, for answering that. And then I can also see a couple of other questions related to translation. And then also, I think with respect to a country context, you would like to take it, or we could also relay these questions onto you, and then this could be answered later also. We are almost, we have just 1 more minute to go.
So I can quickly address the translation one. I've responded in chat, but it's one that comes up often. And this is something that we are looking at, perhaps for a future version where we have, multi-language versions available. However, in the meantime, the how-to guide actually has good guidance that we actually tried and tested during Kosovo's implementation of this to translate many of these things pretty much in real time. Thank you, AI. But it has worked in Kosovo. Obviously, for any automated translation, it's a good idea to look at it yourself once to make sure that everything's okay. But there is some advice in there on how this can be done in real time, which worked for us in Kosovo. So it's not something we haven't tried. But it's an ongoing effort there. Yeah. Very relevant question though. Thank you.
Thank you, Ali. Since we are at the top of the hour, maybe I would like to wrap up, and then also maybe we should have the group photograph before more people actually leave, because it's quite late from this part of the world for many of them. Really very helpful. We are at this stage that we, especially for AeHIN, this is very meaningful, and then this fits in very well with our convergence workshop methodology also. And of course, we look forward for the partnership, and then especially you already gave a hint about the boot camping, and then we look forward for more updates, and then look forward to work together with you. And then Cha, any last minute announcements? Otherwise, we will close with the group photograph. Over to you, Cha.
Thank you, Sir Jai. For the upcoming webinars of AeHIN, we'll be reaching out through the AeHIN mailing list, and please follow us on our social media pages. Our handle is We Are AeHIN. All right. Thank you, everyone.
Thank you.
Thanks very
Thank
much
you all
for the
so much.
opportunity. Always love engaging with you.
Thank you, Ali, Matt, Derek, Amanda. Thanks a lot.